Today I'm in the Altura Learning studios with Dr. Roshmeen Azam, our Chief Medical Officer at Altura Learning. Roshmeen, would you be able to talk us through our latest course release, Caring for People of English-Speaking Backgrounds, and let us know why it was developed?
Absolutely, Penny. This course was developed in response to a critical and often overlooked challenge in aged care: communication between a highly diverse workforce and predominantly English-speaking residents. Today, over 40% of the aged care workforce comes from culturally and linguistically diverse backgrounds. These staff bring enormous value, but they are often navigating not just language, but unfamiliar cultural norms, communication styles, and expectations, particularly when caring for older Australians. At the same time, communication failure contributes to up to 70% of adverse healthcare events globally, and in aged care, it's directly linked to medication errors, consent issues, and clinical quality care.
That's significant. So what gaps would you say this course is addressing?
The gap is this assumption that if staff and residents both speak English, communication is effective. In reality, many staff trained overseas may not be familiar with local expressions, health literacy levels, or the way older Australians communicate, especially when they are unwell, anxious, or experiencing cognitive decline. So even when words are understood, meaning is often lost. This course is designed to bridge that gap and support staff to confidently navigate not just language, but content, tone, and intent in communication.
What would you say that looks like in day-to-day practice?
It's very practical. We focus on skills like simplifying language without being patronizing, checking for understanding, recognizing when a resident is confused or distressed, and adapting communication for cognitive or sensory changes. We also address cultural nuances, things like how older Australians express discomfort, their expectation of care, and how they engage in decision making. Importantly, what it does is reframes communication as a clinical skill, not just a soft skill.
And why do you think this is so important for the sector right now, Roshmeen?
Because workforce diversity is expanding and resident complexity is increasing at the same time. If we don't actively support communication capability, we create risks in clinical, in operational, and at reputational level. When communication breaks down, we see missed symptoms, behavioral escalation, medication non-adherence, and avoidable hospitalizations. Improving communication is one of the most immediate and cost-effective ways to improve safety and quality.
So Roshmeen, what would you say is your ultimate goal for this course?
That's a great question, Penny. The goal is to give every staff member, regardless of their background, the confidence and capability to communicate effectively with older Australians.
Well, thank you so much for joining us today. We really appreciate your time, and get in touch if you'd like this course added to your library. Bye for now.